Hello viewers, myself Dr. Krina, Neuro Rehab Physiotherapist from HealthQ Physiotherapy team. Here today I am going to guide you that things to do for the acute phase or the early phase of Bell's palsy. For the Bell's palsy, to know more about it, we have an already video. Please check out in our YouTube channel. So, after you get medications as prescribed by a doctor, we will discuss things to be taken care in the acute or the early phase of Bell's palsy. The acute phase of the Bell's palsy begins from the day of the Bell's palsy you developed or the paralytic side you developed till the movements which is appreciated on the affected side. Every individual is different, and so likewise the nerve recovery of every individual is different in the course of time. Nerve regeneration can last from few days to weeks to months and can till be continued to 3 months. Things to do in the acute or the early phase of Bell's palsy. For the first is be patient, don't hurry and don't worry. Let your natural course of the nerve takes its own time to recover. Take your medications timely as prescribed by the doctor. Absolute use of an eye drops is used very frequently so that the eye remains lubricated and hydrated throughout the day. In an acute phase of Bell's palsy, your eyes are at maximum risk of damage and irritation with the secondary other complications. So the next is do not forget to tape your eyes while sleeping. Tape your eyes in such a way that eye is completely closed and there is no way for the dust. Taping techniques can be suggested by a specialist physiotherapist. Taping has also the benefit of upper eyelid stretching. Taping can be done only while sleeping. Use the lubricant or the ointment as advised by the doctor and followed by taping while sleeping so that the eye remains lubricated for the whole night while taping. Also, take care of the eyes when you move out of the house. Use the sunglasses which is covered completely so that there is no way for the dust, sunlight or the direct harsh lights so that your eye remains protected and with the less risk or chances of the damage. To prevent direct exposures to harsh lights like screen times from the mobiles, laptops or desktops, use complete protection with the anti-glare glasses. Hence, eye should be completely protected and prevent other eye irritations. Sleep is very important during this phase of time. Sleeping more than that of the usual hours and taking good adequate rest helps the body to heal faster and naturally with the help of the good amount of rest. Next, protection to the ears is must, as ears are very sensitive at this point of time. Hence, the ear cotton plugs can be used in and outside the house to protect ears and prevent further damage. Also, do not sit directly under the AC or in the area where there is lot of wind flow. Next, as your one side of face is affected and has the muscle impairment which cannot be able to do its function as than that of normal, and hence the chewing is difficult. You can use semi-solid foods over the hard ones so that chewing doesn't difficult, and meanwhile during those point of time use the adequate frequent amount of the water so that the food particles doesn't stuck around teeth and you don't feel choking while eating. Prefer chewing on the normal side. Any forceful movements can lead to the chances of increasing in synkinesis. Hence, to improvise the chewing habits, try to use smaller bites or sips than that of the larger ones. Prefer to use straw on the normal side for drinking water. This can help to prevent any forceful activities around the mouth. Also, avoid chewing gums as well as the ballooning activities in the acute or the early phase of Bell's palsy. Next, massage is very important at this point of time. In the early or the acute phase of the Bell's palsy, massage can be done in the twice a day as the routine benefits like reducing in the facial pain, swelling and relaxation helps you to heal faster. Along with the massage, hot compress, steam or microwavable hot packs can be also used. This also helps in reducing facial pain and improves in the faster nerve recovery. Now, next will come up into the things which are not to be done in the acute or the early phase of Bell's palsy. Do not forget to use eye drops in the regular interval of time till the doctor have advised. Don't worry and don't hurry. We understand that you are suffering from lot of stress at present, but stress will add on into a delayed healing process. It is very important to stay calm and stay positive. Now starts its regeneration from the day you're affected with the Bell's palsy, and once the medication starts, it aids in a healing process. So the stress is an impact over the negativity towards the healing process, and thus do not consciously worry. As I said earlier, every individual is different and every individual's duration of the recovery and the nerve affection is different, so that you do not compare your recovery to the others. Avoid looking yourself in the mirror as much as possible, and it's time to take rest. Forceful facial movements enhances the chances of synkinesis. So do not do any repetitive forceful movements on the affected side of your face. To protect your eyes, avoid screen time as much as possible. To protect ears, as the ears are very sensitive at this point of time, avoid listening to the very loud music. Please listen to the music which is calm and smooth. You can use the headphones over the normal ear so that you can listen effectively and do not damage the affected ear. Avoid application of the ice on the affected side. Ice will not help to the healing. Similarly, avoid cold waters, cold drinks, alcohol, cigarettes, sugar, dairy products and refined flour because this increases the inflammation. Avoid chewing gums and avoid eating the hard foods over the affected side. Avoid ballooning activities and do not try to blow air or fill the air inside your cheeks, so that this cannot into increase in chances of synkinesis. Avoid stepping out of the house at this point of time and instead take adequate rest. Do not take overdose of the electrical stimulation. There are several evidences and shows the reports that the electrical stimulation increases the chance for synkinesis, and that leads to the overactivity of the facial muscles. Instead, use of the hot compress as I mentioned earlier and the massage techniques as advised by your specialist physiotherapist is advisable at the early and the acute phase of Bell's palsy. So I hope our video will help you for the better recovery during the early phase of Bell's palsy. Check out our other videos and our YouTube channel. Thank you.